Hey everyone, this is Mike Alexander. We're going to start in 2 minutes. Good afternoon, everyone. My name is Mike Alexander, and I am the director of the Center for Livable Communities at the Atlanta Regional Commission. Today, I am excited to serve as your moderator. First, I really want to say thank you for taking the time to join us on this special ARC training webinar focused on recent work by the ARC Neighborhood Nexus to develop data resources for communities across Georgia. Our hope is to help those communities understand the current and potential impact of the coronavirus. We want to be your partners, and we want you to know that we absolutely need your feedback about how we can help you by improving these tools after you've seen the presentation. Just let us know. Before we get started, I'd like to go over a few notes about the GoToWebinar platform that we are using today. We've taken a screenshot as an example of the attendee control panel. You should see something that looks like this on your own desktop computer in the upper right-hand corner. Throughout the webinar, you will have the opportunity to submit text questions or comments by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. As we go through each presentation, we will answer specific questions about that presentation when I acknowledge that that's the end of that presentation. At the end, we will have a final open-ended question session. During that final question session, all microphones will be unmuted. And let me say that again. At the end, I will unmute all microphones. So if you want to remain muted, make sure you've got that set on your side. You will also see chat messages from us in that window. A few other quick notes. If you click away to another application or browser, you might have trouble finding our meeting again. Look for either the blue flower petal icon in your ribbon bar at the bottom side of your screen, or look in one of the open browser tabs. The orange colored arrow on the control panel for this software will collapse and open that control panel. Also, if it's easier for you to read, you may unpin the question box from the control panel by clicking the square icon in the upper corner of that box. Once you have clicked the drop-down arrow to the right side of that box, please remember, today's training webinar will be recorded through the GoToWebinar platform. This recording will be made available to all meeting attendees via a follow-up email, and it will also be posted on ARC's main website. Finally, you will receive an evaluation survey after the meeting via email, and we would sincerely appreciate any feedback that you would like to give us about this training webinar. Okay, so now I'm going to officially start the webinar, and start with our first slide. And what we want you to know is who's on this presentation with you today, and to represent some of the brightest staff that we have at the Atlanta Regional Commission, myself excluded. So we've got Eric Woodworth, who's one of our great data scientists, and he's going to show you something you may have already seen, an animation tool he built for global COVID cases so that you can understand that impact. John Orr is also with us. Many of you know him. He's the manager of our Transportation and Access and Mobility Group. He's going to help walk through the main COVID tool that our staffer, Shijin Fan, who has a master's in public health from Emory, has built to really help you understand case rate change across the state down to the county level. In addition, we have Tommy Pierce, the Executive Director of Neighborhood Nexus, and he's going to walk you through with Haesung, a senior data analyst with the ARC, the main Neighborhood Nexus website, where we have put all of these data resources up on one page to make it as absolutely as easy as possible for you to find. The first thing I want to acknowledge is there are a lot of dashboards being built across this planet to understand the impact of the coronavirus on our communities. And really the first one that actually went live is still the most popular. It's the one that Johns Hopkins built. And what I highlighted on this screen is a tab that I hope you go look at called the Data Center. Most people spend their time on the main dashboard, but there's some interesting information available in the Data Center. And this map has been up for over 2 months. And it represents really this collective global effort to centralize data to make it available for everyone to understand how the cases are changing through time. And critically, what we've learned at the ARC, that it's so important to understand the rate of change in the new cases. I know we're all watching the news, but this idea of the 5-day moving average, which is available on the Data Center tab on the Johns Hopkins website, is a critical place to be if you really want to understand how countries are doing. And now we're going to be able to show you how metropolitan areas are doing across the state of Georgia. So you'll see this chart in front of you that just shows a slight downtick actually in the US rate of the most recent 5-day moving average. And watching that trend and how it changes is critical for us as we plan for and hope to get back to a 0 case rate with this virus. So to understand that in a little bit more detail, I also screen captured specific country level details so that you could understand these relative rates in comparison. So the critical thing to focus on is look at the actual confirmed new cases scale. And you'll see there's a lot of differences between Germany, China, Spain, and the US. And of course, that rate for the US, that top bar is actually 30,000. Whereas in comparison, the top bar in Germany is only 6,000 cases. So the US does have substantially more new reported cases than these other comparative countries. And again, if you're looking at the orange line, that 5-day moving average, you can see the reported information provided by China, where they really peaked in mid-February. And since then, that average rate has fallen. And you compare that to the United States, where that upward trajectory has been without pause until just the last few days. So that's a good sign for us, but clearly our goal is to be more like the chart that's shown representing China. And of course, Germany and Spain. I wanted these on here to see, we may see an initial trend, a downward trend, but it may actually go up again like it has in Germany. And it's critical for us to be aware of that. There are lots of websites being built in the US. In the bottom left, you see a chart that just got published today by the New York Times for all metropolitan areas over 100,000 people. And you can see the new weekly confirmed cases, which would be a 7-day number for Atlanta in comparison to those gray lines for the rest of those metro areas. And of course, you should take the time to look at that as well. It's another valuable resource. But again, Atlanta has not had that exploding rate, and we're going to break that down in more detail. There's one final point I want to make about big data. And the reality is that a lot of work has gone into making sure that all of these different organizations that are responsible for this health data are working well together. So if you just look at the data resources on the right, you're going to see just the number of different entities that are sharing their data and publishing their data, and the central repository for the data that's pushed back out to us that we can consume to make these different data visualization tools is represented in that top right hyperlink. And GitHub is a fundamental resource for this whole planet now to publish open source data. And I really hope, even though you may not be the data geeks that we are, you take some time to understand how valuable having this data available to us is so that we can consume it and make the tools that you're going to see. Finally, there's been a lot of discussion at the ARC, and we've gotten a lot of questions about the modeling of this. And I can't say enough that we are not health epidemiologists at the ARC. Shijin does have a master's degree in public health, and he is so bright. But again, we are regional planners and data scientists. So take everything we say with a grain of salt. That said, I think it's very helpful to look at the article link in the bottom right that really just got published a couple days ago by The Economist on these different modeling tools to understand when these peaks are expected to occur. We're not going to talk about those peaks today. We think those data resources are really beyond our capacity at the ARC to talk about, say, one short tool we built to understand very short-term change that I think you'll find very valuable. I also wanted you to know we had spent a lot of time at the ARC building a web-based data collection tool to understand the differences between the types of shelter-in-place orders that our local governments were passing and implementing at the local level. We built this map to highlight the differences between those local orders. And of course, we were about to publish that map when that map was superseded by the statewide shelter-in-place order. We also know that statewide order is expected to expire on April 13th, and we're all going to be wondering as citizens what comes next after April 13th, and what kind of guidance and rules and regulations we're going to get from the state. But again, we're committed to making sure we create, as with our partners like GMA, the best data resources available to understand what each local government is potentially doing, especially if we do end up long-term in a place where those rules are again fundamentally different because they're adopted uniquely by each local government. All right, I'm about to turn over the screen to Eric Woodworth to show you the animation that he has built. And Eric is someone that we really lean on at the ARC. He is that unique person that has a planning background, but also has some of the best programming capabilities and capacities that I've ever seen. So he took some of that data I just described from another source and built the animation that he's going to show you here in just a second. So I'm turning it over to Eric. Have you got it, Eric?
Sorry, can you see my screen, everyone? Good. I think I can see the preview, so it looks like it's the right one. Hello, I'm going to go through this rather briefly so that we can spend more time with some of the more exploratory tools. I built this initially, just a little bit of background. As soon as we started getting access to some of the data that was coming out of Johns Hopkins, as a means to communicate sort of publicly and the rapidity, the rate in which we were seeing the spread. And so I wanted to do that, and I thought the best way to do that was with an animated mapping tool, and to look at it at different scales, right? So we can think of it spreading globally, and then of course as it's spread through the United States, and then in the state of Georgia. So this tool, you can see here, has a toggle between global and United States. So if we look at the global view, you can see it starts on January 22nd. This is the first date of the available data that we have. And then it gets updated daily through our data feeds. You can control the speed of the animation. So we do a quarter second here. Let's start it in the middle. So we're not waiting for it too long, but you can see the spread with both confirmed cases and deaths across the world up to April 5th, which is the last day of data yesterday. We can also toggle again between the United States and the global. So at the US level, we have the county level data. And if we zoom in, we can begin to see greater resolution between the different areas. So this is, of course, the most hardest hit currently, New York. But we also, of course, have Georgia. If you don't want to see the entire country, you can dive in even deeper and look just at Georgia. This will reset the tool to the first date. We can run it very quickly now and see. So very early on, we didn't see much happening in Georgia, but over a very short amount of time across the last month, we've seen an explosion of cases. And if you click on any of these in the bottom left-hand corner here, you will have the information, most current information based on the date. So this actually will change relative to the date here. So you can see within a location, the change over time. So that's pretty much the main tool, the animation tool, and the purpose here again is to demonstrate to people the severity of this and how quickly this is spread. Notice, however, at the top here, if you would want to share this link, you can share it in different formats. So if you are on the state of Georgia and you'd like to share this with just the state of Georgia as the first view, the user, of course, will be able to change it once they get the link, but it'll start up with Georgia. You can share the link as follows. If you remove the GA from that, it will load up for the entire United States. And here's a really quick preview of some other features that we're going to be adding shortly. So the link will stay the same, but there'll be some other features, particularly these charts. This will allow for comparison between different geographies. So you can see here, Italy, let's do United States, Italy, and so now what we're seeing actually is not the total number, but the rate. So this is the people per 100,000 with confirmed cases per 100,000, and then the deaths per 100,000 people. And we let this run all the way to the end. You can see here in this tooltip, the rate in the United States is about 102 cases per 100,000 people. Italy, much higher, 213, but we're very close to the rate that we saw in the ground zero of this pandemic in China. Additionally, if you wanted to make a comparison in the United States, we can do that as well. So if we scroll over here, we can see the eastern portion of the country. We have Fulton County for comparison purposes. A hot spot that many of you might be familiar with in Georgia, Doherty County. And let's compare that to another hot spot in the country, the Bronx, New York. So using this rate here, you can see that in fact, at this particular moment in time, the confirmed cases per 100,000 in Doherty County and Bronx are close. They were a bit closer a few days ago. If you look here on March 31st, the Bronx has begun to sort of see a greater increase relative to Doherty County, but as well down here at the deaths. This is helpful to understand the severity relative to the location, right? So if a smaller area will have smaller people, it might not seem like they have a lot of cases, but when you compare it to the overall population in that area, this allows us to identify hotspots. So these are features that will soon be available. They are not currently available on the tool at the moment, but those will be soon. So that's it for me. And if you have any questions, make sure to type those into the questions box. And I'm going to pass this along to our next presenter. Mike.
Hey, thanks, Eric. I'm about to switch the presenter to Shijin, who's going to show us his COVID tool as well. And I think you guys will find this absolutely fascinating. And I don't mean fascinating in a happy way, but just very, very helpful in understanding, especially these comparative rates of cases as they're happening in Metro Atlanta and the whole state. So Shijin and John.
Yes, my name is John Orr with the ARC, and I manage the Transportation Access and Mobility Group. And Shi Chen is going to share with you some information, a visualization tool that allows a user to look at the data in a variety of ways, and also includes a relatively short-term forecasting mechanism as well. So Shi Chen, I'll turn it over to you.
Thank you, John. This is Shi Chen Fan speaking. The current screen shows the dashboard we built for the COVID-19 statistics in Georgia State. The data is using the county level data from 1.3 ARCs, which is one of the data source used by GHU's visualization tools. And we validate the data with Georgia DPH's daily reports. The data in this page will update every day morning, and it covers from the first case in Georgia since March 2nd till yesterday 7 p.m. So this page is composed by 3 parts. The map on the left showing the spatial distribution, and a line chart on the right shows the time distribution, and there is an exponential growth models at the bottom for showing the trend and prediction. So for the map and the line charts, the default setting is the metrics using the cumulative confirmed cases, and region is selected as Metro Atlanta 21 counties. So on the map, people can zoom in, zoom out, and see the cumulative cases in the circle size, and people can click, say the exact numbers for each county. And there's also a function to change the chart type to bar charts. So the users can also select a date in past to view the trend, and also is able to play it as an animation. And for the line charts, it shows the time trend. People can compare it by counties. On the top right, there is function let's compare data on hovers. So the user can see each county's numbers by each days and compare the spread speed. So for the region, there is also able to select as the state level. Now we switch to the Georgia state. And for the state level, we can show the line charts by region or by MSA or by counties. So from the map, we can see that most cases happens in Atlanta region and the Albany regions. if people interested in looking for detail for a specific MSA region or regional commissioner area, they're also able to select it in the select box. For example, to see the Albany or Atlanta, and the regional commissions is here. And we go back to the state level. So we have 9 metrics here for the cumulative confirmed cases, and we also have the daily new confirmed cases. And we can switch to that. Here we have a function to switch to the y-axis to 5-day moving average. That lets people can view the increase trends in a more clear way. And as the population size is quite different for each county, and place with this population may also means have less medical resource. So we have some metrics for rates, like it's calculated by per 100,000 people. As we switch to cumulative confirmed cases per 100,000 people, we can see that the Southwest Georgia area, the situation is more worse than other place in the state. Okay, we can see the line chart here. The brown one, highest one is Southwest Georgia. So for the death data, we have similar metrics as the cases data. This can be shown here. And the next part is a simple exponential growth model. So for the early stage of the epidemic, the disease increase will follow exponential growth trends. So we can see the plot here. The blue line is the estimated cases, and the orange point is cumulative confirmed cases. And when we hover it on the points or lines, we can see the exact dates and numbers. We have a next 5-day prediction based on the models. Here we can see the April 5th, April 6th, April 7th. And we are also able to switch the y-axis to the natural localized. And from this model, we got 2 numbers. One is the exponential growth rates, one is the doubling time. These 2 numbers showing actually same information. The doubling time is a more easy to understand way. It means that following the current trends, like this is for state level, the state level's cumulative cases number will be doubled every 4.5 days. We can also switch back to regional level. So for the Atlanta 21 counties, the doubling time is 4.8 days. It's a little slower than the state level. And for better understand the doubling time, here is wonderful articles at Forbes.com. It explains the exponential growth in a very easy understanding ways, and it has a summary table of the doubling days in the world and in other regions. This data is till March 15th. We can see the 4.5 days doubling time is similar to other European country, Italy, Spain, French is about 4 days, and last month United States is about 4 days. So the growth rate is a little slower now compared to half months ago. And this model is just a very simple model. And for now, there are many research on the epidemiology prediction. Here is a link provided here is some tools developed by Harvard and University of Washington. They have more complex prediction models and compare it to the healthcare capacity. If you are interested, you can explore it by yourself. And for any feedback or suggestion or questions, if you have this after the webinar, you can click the buttons and email us at dash@atlantaregional.org. Thanks.
John, do you have anything you want to add?
That has it covered, Mike. Thank you.
Yeah, I'm gonna, let's see if I can get my screen back up. All right, everyone, hold on just a second. I want to try to go to webinar. All right, we're going to switch screens again, everyone. I appreciate your patience. I'm not the best at switching these GoToWebinars. I do hope you understand before I click and change this that, you know, we've really taken our ability to understand what's happening down at the regional level across the state to a place that's very similar to a lot of the national tools. So this is absolutely unique. It's critical for us as we understand it to really understand what that doubling rate is. And the first time as staff, we got to look at Shenzhen's doubling time. It was at 3.2 about a week ago. And now that doubling time is up to 4.8. And that's a good thing. The longer it takes to double the number of cases, the better we are doing. So this doubling time and that 5-day average rate of new cases is so critical as we really start to watch these gauges in understanding, are we doing better? Is the shelter in place and of course our social isolation helping us to get those rate numbers down? So this is a critical tool for anyone across the state to understand, recognizing there's a lag in the number of cases based on testing to understand where we really are. And I heard something, read something today about Germany. And of course, their chancellor said, we don't want to talk about opening up Germany until we saw the case doubling time being over 10. And so that's just one country's kind of approach to understanding when will it be acceptable to make some changes to allow people to leave their homes. So this doubling time is something that I know we'll be checking every day to understand, recognizing there's going to be some bumps in the data along the way for us to understand really where we are. All right, so I'm going to switch the screen over to Tommy and Haesong so they can walk you through some of the locally focused tools to help you understand your communities and along really and through data that gets at this idea of our most vulnerable populations. And these are the places that we're going to have to be critically focused to make sure that as much as we can, when we do really have to treat people and the case rates are starting to grow, that these are going to be the people that are the most vulnerable. And this is very spatial information, which I think everyone needs to be aware of. Tommy, have you got it?
I think so. Can you see my screen? Yes. Great. Well, good afternoon, everyone. My name is Tommy Pierce. I'm the Executive Director at Neighborhood Nexus. You'll see we're not on the ARC's website. We're actually at neighborhoodnexus.org/COVID-19. Neighborhood Nexus is an initiative of the Atlanta Regional Commission. We're housed in their research department. We're also a partner of the Community Foundation for Greater Atlanta, our fiscal agent, as well as the Metro Atlanta Chamber of Commerce and United Way of Greater Atlanta. Our mission and our goal is to help mission-driven organizations, whether that's a nonprofit or a community group or a local government or state agency, to really think about asking the right questions, using the best data to tell compelling stories and to make more informed decisions. So that's where we've brought into this, and how we've really thought about this page. We're trying to be thoughtful, knowing that there's an overwhelming amount of information out there right now. Is trying to figure out what is most actionable to either understand what's happening here locally and globally, but also to then immediately support our communities. So we've put together this page that we're kind of the central repository of what we think is most critical right now. My email is listed sort of in the right up front. If you have suggestions or thoughts or anything that would be useful for you and your constituents, please reach out, and if that data is available, we'll take some time and really think through that. And if you have other resources you think are critical, we'll try to get them onto this page as well. At the same time, that means this page is a bit much. There's a lot of tools here, so we've kind of organized this into 4 main groups. This pandemic has immediately become a health and an economic crisis. So our first section here is focusing on health indicators that point towards where those medically vulnerable populations are, who we think those might be, and pointing there. The second section is really on economic indicators to figure out who might be most at risk of losing their jobs, but also based on income. We're really trying to stabilize families in this first phase of relief efforts. The third piece is around data of incidence and mortality and tracking that over time. So it includes both the tools you just saw. We're really trying to help add context and tell the story, and then going forward, we're going to be able to look back and kind of evaluate how this went given different policy interventions or relief efforts. And then the last piece is a list of community sources, mostly links out to other sites who are doing this really well and focusing entirely on that. But we also have a map of all of the local testing sites. So I'm going to jump into this first section, and I'm going to let Hei Sung, our senior data analyst, walk you through this while I try to play her Vanna White and keep up with the mouse.
Thanks, Tommy. Good afternoon, everyone. My name is Hei Sung. Let me briefly tell you how to use this interactive map first. Layer list is on the left and legend is on the right. Data layers in the layer list, and to turn on and off the layer, please click on the checkbox next to the layer name, like that. There is a swipe function. Using the middle bar, you can compare 2 data. You are looking at the census tract data on the left and county data on the right, so you can compare those 2 geographies. Click any geographies to see the detailed information. Yes. If you want to turn off the swipe function, please click on the window shape icon on the top left. If you click I button next to it, it will give you more information on the source and updating schedule. Now I will talk about the data. These 2 maps are interactive heat maps that show where the most vulnerable groups are located. First map shows the medically vulnerable groups. There are COVID-19 information, older adult population, birth rate, diabetes, and respiratory disease data. Older adults age 65 years and above, and people with diabetes and respiratory disease are high-risk groups according to CDC. Birth rate is used as a proxy for the pregnancy rate in the county. This can offer insights into potential hospital demand for current pregnancies. In the most of cases, data are available at 2 types, one in pure count and the other one is percent share of the data, or cases per capita. So you can select data layer at your interest. And like Tommy do, you can zoom in and out the map. Not only medically vulnerable groups, but also economically vulnerable groups are crucial to be recognized. Next map shows the distribution of economically vulnerable groups. Income, housing cost burden, and insurance status are available to see at census tract level and county level. In the layer list on the left, you will notice that the layers are divided into 3 groups, and the 2 groups are divided, indicates the 2 geographies, census tract and county. Likewise, the swipe function enables you to compare census tract and county level data. And these are available along with COVID-19 data and CDC's Social Vulnerability Index. Again, click any geographies or I button for further information, and you can see the data by clicking the geographies. We hope these maps can help to identify potential places where the resources and plans might be needed the most. Thank you.
Thank you, Haesung. So these maps, these are one of the first things we put together as the CDC put out their recommendations, and as they continue to update that and learn more about, you know, what are the underlying conditions that make people most prone to this, we'll keep updating these maps. You know, in the first couple of days, we had someone from the mayor's office, Open Hand Atlanta, some foundations kind of reached out to say, can you show us where aging people are and aging people in isolation? We can do all of that. So if you have those questions and you're not able to find it on these maps, let us know. We also know that being contained in this smaller screen is could be a little constricting. So you can open each of these in the full screen mode by clicking on below each one. Along with the economic vulnerable, we've been doing some analysis, and this is a little bit subjective, but we're solidifying the criteria. So this will continue to evolve. We're having a lot of conversations and working with ARC's forecasting and modeling group to figure out which sectors and industries we think are most at risk. This is a chart here, and like I said, it'll continue to update, but it looks at how many workers work in that industry in 2018. And this is the average wage for industry workers in those same industries, right? So what we're looking at here, and the only ones shown are those that we think are threatened right now with job loss. So you can see that among the top industries, 6 of them are also lower wage, making below $35,000 a year. I'll look through these so you can see what this looks like, but this is interactive and it has provides a little bit of detail. So restaurants make up both of these top 2, and that's going on 200,000 workers in the restaurant industry. Next is supermarket and other groceries, warehouse, clubs and supercenters, hotels and motels, and department stores. You can see there's another one that's at risk up here, but with higher income, and that's pilots. And scroll down to the next tool. And I'm going to do a refresh. You'll notice that as we go through some of these, the app may not be working. That's because we're literally working on these to improve them as we go. All right, so this is the app, the dashboard that Sishan just walked you through. You can do all of the same functionality within the window. However, it does, and we wanted to get it here. However, it does work better at full screen mode, and you can do that by clicking the button right below. Next is Eric's tool. It functions just as you saw demonstrated from within the frame here. And again, if you want that as a full screen, you can click this button here and it'll take you right to that site. We think that this tool will be particularly good in telling the story now to see how this has evolved over time, but then looking backwards to see when were certain policy decisions made or not made and how did this play out. So we think this will be a great evaluative tool. Because we're trying to make these actionable, one thing we've done is created GIFs of these images to put into presentations. So if you need anything like that or any additional support, let us know again. And Eric showed some additional charts that will have a pop out here. As that's updated, it'll be available here as well. This is to hopefully make sure you don't have to memorize a bunch of different URLs and you can access everything on one page. Next, this is not an embedded app, but it does link out to a page that Esri has put together, which is taking some critical information about local resources and assets, as well as demographic information to kind of assess risk and potential for planning interventions. This is the Doherty County. If you click this link, it'll take you to an Esri GitHub page where you can select any county in the nation. And then our final section is around community resources. We didn't want to make an attempt at doing this when other organizations are already focusing here. If you're a nonprofit, the Georgia Center for Nonprofits has the most comprehensive list right now. They're also putting on lots of webinars, recording them, and then putting the recordings up on your webpage. So if you're a nonprofit organization worried about business continuity or better serving your constituents, go to their link. With local governments, we have GMA and ACCG's links here. If you're looking for health updates, the Georgia Department of Public Health and their daily updates are here, as well as the latest CDC guidelines and at-risk groups. These are the sites that we're monitoring most as we kind of support the organizations that we're working with. And then finally are the testing sites. This is where you can actively go and get tested for COVID-19 right now. This is updated as they exist in real time. You can look back out and see that this is a national map that focuses in on Georgia. And then you can also see kind of the unique patterns that align with maybe some of our more vulnerable populations, and that there's only testing sites on the northern half of the city at the moment. That's the end of what we have on our site. And like I said, my email is listed here at the top, tpierce@atlantaregional.org. Please reach out with any questions you have about the data or any suggestions or resources that would help you better serve your community. Thank you.
Tommy, while you've got that up, you want to talk for just a second about some of the questions you've been asked in this role as really this person who responds first to these real fundamental questions about data resources as it relates to the virus. Some of the things you've been asked to kind of help everyone else understand, you know, where information is really needed.
Yeah, so I think my role here is to really think through the data and visualizations and information that we have kind of from the perspective of nonprofits and from philanthropy and state agencies that are really trying to provide relief efforts and need to know action steps right now. Some of the first groups that reached out were the foundations that are creating relief and recovery funds to figure out, we're collecting money, how do we get this out quickly? So what's that framework? You know, we're working with a lot of data, but we're also analysts, right? So we're coming up with frameworks to help think about, well, let's look for those groups that are already serving the most at-risk populations, that are already providing those most critical basic needs, at least for now, because we're trying to stabilize families and local businesses. And then who has that infrastructure that if we injected that cash right now, that they could do something with it and have the biggest impact. So we're trying to help guide different organizations thinking. Open Hand, which you probably know of, provides meals and already has that sort of huge infrastructure and volunteer network to get meals directly to people's doors. Them partnering with the community foundation, but needing to know, you know, where are the 65 and up, maybe living in isolation who don't have the resources to get out. We can point people in the right direction. We've pointed some local cities in the right direction to say, here's where the need is. Let's help you find some partners that exist there, because, you know, you can get a census tract, but you're probably not going to go door to door. But let's figure out who's already serving that area and then partner with them to kind of combine our resources. This is a real time to kind of collectively get together and build some really strong partnerships that, you know, hopefully will go beyond just this. But the GCN, there's a Metro Atlanta task force right now that's kicking off tomorrow. So efforts like that, you know, are real opportunities to sustain this into the future, but also providing some critical resources right now.
Absolutely. I'm going to take over the screen again and just bring up the PowerPoint one more time. Obviously, all these data resources are available on that Neighborhood Nexus website. You know, I think what Tommy said is critical. When I use those tools, I definitely try to maximize them, take them out of that frame. It's just slightly easier to use. But I hope you see the value of the amazing work that the staff has done with these tools and how hard we're trying at the ARC to help provide information as we can that's relevant to really helping our communities understand this virus and what it means. And I think Tommy said it really beautifully that, you know, we've got this really direct health impact, and we also know that there's this critical economic impact. So you can expect to hear from us that we're going to be doing more webinars on the economic impact as more information becomes available. This has happened so quickly that we know a lot of the data hasn't caught up and won't catch up for quite a while. But we all know that this is having a dramatic economic impact as well. We want to make sure as much as we can, we're building resources that are going to help us to understand, plan for the best public policy we can get to try to mitigate these potential impacts. With that, I'm going to look. I'm not sure I see any questions. Maybe some of the other panelists can click on it. If you have a question right now, please send it in to us. And I'm about to turn the mics off. If anybody, turn the mics on, actually, if anybody wants to ask a direct question. So again, here I go. I'm going to hit the button. And so make sure yours is muted if you want to stay muted. So anyone can ask a question now that they'd like to ask. And of course, you're more than welcome and to ask those questions in the chat feature as well. Oh, wait, there are questions. Sorry. All right, so the first question, and I think this is a Tommy Haysung question. It's, what is the criteria for an area to be determined a hotspot? And it was from Paige Havens, but she left. Or it might have been an Eric Woodworth question. So I'm not sure if the reference was just to the number of cases. And, you know, I think I can say just us watching the data as non-health experts, you know, where we see rates of new confirmed cases that are matching some of the most intensely changing places on the rest of the planet, those are clearly areas that are hotspot. And I got to be honest and say that my heart absolutely goes out to the people in Albany. This has been very, very much a very, very, very hard time for them. And we're so sympathetic to what they're going through. And clearly, when we're comparing their data to the rest of the globe, they're experiencing those very high rates right now. We're hoping the best for them, that it'll get better. The second question, I'm not sure this is hard to answer, but I'm curious if using all this data, do y'all have any estimates of when Atlanta will open up again, even a range? And I think I talked about that at the beginning. There are a lot of models that people are running. If you click on that article that I posted from The Economist, it is the most efficient writing I've read yet to explain the models. In fact, University of Massachusetts at Amherst, I believe, in that article, is doing a survey of all the modelers that are running these models that help us set an expectation of when the peak case rate will be. We're not experts at that at the ARC, but we are obviously interested in those numbers just like you are. I would say looking at that as a resource and understanding that, the 538 website put up a pretty thoughtful article as well about those different models. And, you know, we've asked Shijin to look at those. He does know a lot about those models, and maybe at a future date, we'll start to talk about that. But again, the one that everyone seems to be leaning on the most really has, and just updated with our shelter in place. And you can look at that one. We'll include that in the email that we send out to you to show you when they think that peak usage will be, especially of the healthcare facilities here in the state of Georgia. Yes, you will absolutely get a link to all the slides, Laura. As soon as we finish this, we will be happy to send out an email to all the participants so that you can have this PowerPoint as well as all the links. The next question is from Odetta. I hope you're doing well, Odetta. Is anyone disaggregating data by race or income level? And if you mean the case data, Eric, maybe you and Shijin want to talk about the level of data that's available right now, because it is pretty limited. Eric, Shijin?
Yeah, I'll defer to Shijin on that one.
I think for the county level data, they only have the count on cases and deaths per day. And for the age distribution, the Georgia DPH daily report, they have state level data. But I think there are not information on race and income.
This is Tommy. We're closely tracking how organizations, so we're part of the National Neighborhood Indicator Partnership, and only some states or cities or counties are even releasing race and ethnicity data right now, because it seems to be so unreliable, or there's not enough data. They're not getting it out of enough patients. As that becomes available in Georgia, we will absolutely look at that. I think right now North Carolina might be the only state really doing it consistently. but we're working with national partners to figure out how they're doing it, and we'll take their lead there.
Yeah. Next question is from Tejas, and can we add racial data to the neighborhood nexus maps? We absolutely can add that data, and that's a great question. Comment. Can we get hospitalization data by county? DPH is reporting at the state level. This could be an indicator of severity. Colin Martin. Hope you're doing well, Colin. That data, as far as I know, isn't published in a way that we can consume it right now, unless anybody else on the ARC side knows of any specific data. The one national data set that we have published into most of the mapping frameworks is bed capacity data that's being gathered nationally, but that doesn't have the utilization rate, unless I'm saying that fundamentally wrong. Anybody from the ARC? Again, it's a great question. Anybody?
I mean, that's correct. You know, they have hospital capacity is something that's sort of hard to find generally, but there are some numbers. But yeah, in terms of looking at utilization and more current information, that's something that we don't have.
Yeah.
Something I'm sure exists. It's just a matter of getting it up to the places that they can then distribute it down to all of the others. So again,
Right.
Something we would like to have if anybody knows a way to get that. But yeah, it's something we don't have at the moment, short of what has been released with some of the modeling work that's been done nationally.
Yeah, and that's critical. And you know, these are very large hospital systems that are maintaining their you know, their relative capacity. I know they're all very focused on bed capacity and utilization rates every day, even without this current virus. So, you know, the more data that's made public through any of these reporting mechanisms, I think you should definitely feel that we would, you know, very quickly republish that data utilizing these tools as we've already started to develop them, because we recognize we're going to be looking at this data for months. And so we want to make sure we've got the best tools available. So Colin, that is absolutely a fundamental question. I wish we had a better answer for you right now. I'm sure the state is working on that information. We don't know a lot about what kind of information they have internally to look at that and how that works exactly. But again, I think it's a fundamental question.
I think answering that question would really help us answer the first question from Paige about where are hotspots, where probably the pace has to do with it, but also where we're depleting resources and need beds.
Yeah, I think as Americans, we're very committed to everyone's individual privacy, and I've been scouring the web looking at other data visualization tools, and I've only found on just a few maps that really go below the county level. Georgia has relatively small counties, and that's why some of the data looks the way it does. There are big spatial differences in small counties, over a large geographic area like Georgia, but like Philadelphia and New York are just two of the few places that are actually publishing sub-county level data, which is really what you would need to get at this idea of where there are concentrations of people who have tested positive. We're just not there yet. And we are always trying to work with our state agencies and other regional partners. That's one of the reasons why the question was from Leslie Langley, are you working with your state partners to showcase this data? I'm not sure I would use the word showcase, but make this data available. We want to make sure everybody has the best information possible. Hopefully today, this meeting, this webinar will lead to more instances where we're publishing this type of data. Again, our focus is on our local communities across the state, not just Metro Atlanta. So we wanted to get this first round of data out where we took some very basic data and we really made it a lot richer with the per capita rates, which I think is very, very, very helpful at that idea of a hotspot, but at the county level. So we'll continue to work on that as we go forward. So that's, again, a great question. We've got just a few minutes left. If anybody has any additional questions, I'm happy to take them, but if not, we'll bring this webinar to a close. I did want to show you that we recognize this is a unique time in America's history. Our work has to change. So we've started doing these webinars, recognizing that as we learn things and we do what we do in building the tools to try to understand how our communities are changing, we want to make that available to you. We had over 120 people on this webinar today. I can't thank you enough for spending the hour with us, and we're going to continue this. The Atlanta Regional Commission is really made up of local governments. And so to that end, we are absolutely going to continue this webinar series. And the next one will be this Thursday at 1 o'clock. And we have talked with our local governments, and they're really working on becoming truly virtual. And that means for them that they've got to get up to speed on leveraging these webinar tools and how to conduct a public meeting online and make sure that meeting is truly public, and then all people have an opportunity to participate in those meetings, which is a challenge. So we put together the next webinar that will be, again, a Thursday at 1 o'clock on that, these successful tools and techniques for hosting virtual meetings. We've already included the link here on the PowerPoint. And again, this will also be published to the main ARC page as a description so that you can go to the ARC COVID page and see this next webinar. We anticipate holding, our goal is to hold 2 webinars per week for the next 2 months. It's likely we're going to do some economic webinars to follow this up after this next webinar. If you have ideas for webinars, please email us. If there's information that you really want us to go do what we do and research and come back to you that would be helpful to you, we're here to be a partner for you. So again, I want to thank all the staff that have put so much work into this to get us to this place where all these tools are available in one easy location for you to use. I can't thank them enough, and I hope you will take the time to email them. They have done an amazing job at building these tools out. I could not be prouder of their work. And again, thank you so much for your time today, and be with us on Thursday. Thank you. I'm muted. Yeah. Oh, wait, wrong thing. I got to click off. Go to meeting. End webinar for all.